The work that we've been doing on screening at the University of Dundee has translated into saving about 150 lives from bowel cancer each year in Scotland. I came to Dundee in 1996 as Professor of Surgery, and I'm a co-director of the Centre for Research into Cancer Prevention and Screening. And the first work that I was involved with here was to run a pilot of bowel cancer screening in Scotland. And as a result, the Scottish Government decided to roll out bowel cancer screening across the whole country in 2007. And we estimate that that prevents about 150 deaths from bowel cancer each year. Now, so parallel with that, we have run a CSO-funded research unit into screening. And the most important piece of work we've done there is to develop a new approach to testing for bowel cancer called fecal immunochemical testing, sometimes abbreviated as FIT. And as a result of that work, this test has been introduced into the bowel screening programme. It's easier to do, so more people do it, and it's more effective and accurate. So I am the clinical director of the Scottish Bowel Screening Programme, and the programme is run out of Dundee, so it's been quite straightforward to translate the research that we've done in Dundee into policy quite rapidly. I'm also fairly recently become the chair of the United Kingdom National Screening Committee, and that again allows us to feed very directly into policy. Now, one of the problems with screening, of course, is it's designed to detect disease early. It's not really designed to prevent disease. And one of the main reasons for coming together into a centre for prevention and screening is to try to develop methods of preventing cancer as well as detecting it early.
I'm particularly interested in cancer prevention in relation to lifestyles, so that relates to diet, physical activity, alcohol and so on. And my area of expertise is around behaviour change, so it's using behavioural theory to help people to change their everyday activities that are related to cancer risk. And our programme of work has been combined with cancer screening, and that includes both bowel cancer screening and breast screening. One example of combining prevention and screening research is in our Bowel study. This is a completely unique study which was funded by the Medical Research Council under the National Prevention Research Initiative. Within this study, we invited people who'd had a positive test for bowel cancer, but in fact did not have the disease, but some early indications that they were at higher risk. And we offered them a lifestyle programme, individualised, according to their weight, their diet, their physical activity. We got very good results, publication in the British Medical Journal. The Scottish Government are interested in this work, and they are currently funding a feasibility study to see whether we can roll this out across the NHS in Scotland. We also run the Scottish Cancer Prevention Network, which is an organisation that aims to disseminate to the public current understanding and evidence about cancer prevention and screening research. So, changing lifestyle in Scotland is difficult, but our research has succeeded in helping people to change their body weight, to change their diet and the physical activity. So we have demonstrated that we can do it and lead the way on that. Our research group is also committed to communicating research evidence through to policy users, to practitioners and to the wider community. So part of my work as president of the UK Society for Behavioural Medicine will take this research forward. In addition, we also co-direct the award-winning Scottish Cancer Prevention Network, and the network was lucky enough to receive the Stephen Fry Award for Excellence in Public Engagement with Research this year.